Hey everyone, welcome to another exciting episode of Coffee with Alice. This is Coffee. That is Dr. Alice. You already know who I am. If you don't, probably better for you. And we have some breaking news. That's what we do here at Coffee with Alice. We talk about the naked truth. We give you the straight shoot. So there's news reports coming from medical outlets that they're trying to link testosterone to COVID-19. What?
So that has been something that has been causing a lot of angst, at least on my side. So let me just read off some stats.
Oh man, I can't wait for this.
So read off some stats in regards to the reason why people are coming to this this conclusion, this link or something like that.
Yeah.
So it appears that 58% of the patients who are passing from COVID are male. Okay?
Okay, 58%.
58. Now, if you break it down and stratify it, like who's actually dying according to age, then they're saying that about, the 30 to 39 group, about 82.1%, 82.4% is actually male. Amongst the 40 to 49-year-olds, 73.1% are male. And 50 to 59-year-olds, 78.5% are male.
Okay.
And 60 to 69, that's 79% male. And, of course, it's just blah, blah, blah.
Okay.
So, of course, some scientists are asking, is it testosterone? That's actually...
Of all the things, hang
on a
second. Of all the possible factors that could go into the mortality rate of a male in COVID-19, testosterone. That doesn't make any sense. But go on.
It doesn't. I look at that, I'm like, okay, first of all, we already know that testosterone has been on a massive decline for the past few decades now.
Right.
So sperm count has dropped by 50% in first world countries.
It's a sore subject, but that's okay. Keep
sorry. But 50% at least, I think it was a study that was released about 2 years ago, a meta-analysis finding that it has dropped by 50%. Here, clinically speaking, I have tested teenagers who have lower testosterone than their fathers who are 40 or 50 years old.
Right.
I really don't. I mean, honestly, this is not a testosterone issue. This is one of those situations where you have a bunch of PhDs, maybe some MDs who are PhDs as well, or DOs, whoever, and they're more of the research mind, and they're not really going out there and clinically treating patients and making, unfortunately, really, really unfortunate correlations.
So, you can easily test that by pulling the testosterone from either. Can you do a postmortem? I don't know if you can.
No.
So while they're in treatment, you pull a hormonal panel.
No, unfortunately, that's not part of their concern.
So there's always a catch, right? Who benefits? Cui bono? Like who? What's the catch? Why would they single this out?
I'm really uncertain as to why they're doing this. Now, first of all, they're even talking about maybe using testosterone deprivation therapy to try to treat COVID in male patients who are, hospitalized for this sort of thing. To which I'm like, you're going to take away their testosterone.
My libido just left the room crying. Testosterone. I've heard of oxygen deprivation or sensory deprivation. What is testosterone deprivation?
So in some cases where patients are being treated for prostate cancers and it appears that the testosterone is in fact feeding into that cancerous pathway, there is testosterone deprivation. So I'm not sure. Again, this isn't something I would never ever personally look into. That's why I don't know what the drug is. Mm-hmm. But they would give them a particular drug that will completely castrate them.
Is that I want to be really careful. So if someone is, let's say, trying to hormonally transition, right? Is that what we're talking about?
I believe so. That's part of that as well.
So, a ton of estrogen, testosterone blockers.
So there is a testosterone blocker, yes. The other kind of side is that there are some researchers who are thinking about giving men estrogen to try to treat this virus as well, to which I'm like, oh no, what are you doing? It's
So the media thinks that our president recommends drinking fish tank cleaner, and then there's another group that says, hey, let's give them boatloads of it. Like,
right. I mean, here's the fact. Gross majority, and I just read that the age group in which these men, that are the stratification of who's passing from this, that age group notoriously has low testosterone already.
right.
You know, we rarely ever see optimal levels of testosterone without some sort of assistance.
So unassisted, meaning like testosterone replacement or
clomiphene or anything like that.
Clomiphene. We should do a talk on clomiphene, by the way. So you can count on probably one hand the amount of like booming testosterone in the optimal. And I don't mean normal, because normal's range is
It's massive.
like Homer Simpson is considered normal now, right? Like as far as BMI is concerned. And I love The Simpsons, by the way. Seasons 4
Like the
through
range
10.
is 200 to 1400.
Yeah, 200 to 1400. So if you throw a dart at in any direction, you can be considered normal.
Yeah, yeah.
So the idea is you can count on one hand the amount of population that the men and men you've seen with normal testosterone, optimal testosterone rather.
In fact, I could tell you I've only seen one person who had higher than normal like higher than normal testosterone.
And because of HIPAA, we can't reveal that. But was it me?
No. No.
Okay, so now let's getting back to the data that you just shared. It is clear, based on the reporting, that there is a over population of males that are seen in these age groups. So what if you were to kind of like to create some correlations? What other factors are, like, men maybe don't see their doctor very much, they're kind of stubborn, they eat hamburgers and fries, like what other factors do you actually see that would actually contribute to this perfect storm of mortality?
So I think David Sinclair, he's a longevity researcher at Harvard. He actually just did a post where the top 5 kind of risk factors or kind of elements that would result in you passing from this particular drug. One was, yes, being male. The other one was, in fact, being over the age of 65.
Okay.
The other one, diabetes. The other one is hypertension. And I believe the last one is obesity. So in general, males are going to have a lot more of an issue around cardiovascular disease.
Correct.
Most males do not eat well. They drink a lot. And they definitely don't go to the doctor, so they don't even know that any of this is happening in their system. And that's, in fact, what we see mostly here at Stark is just like the early signs of some sort of cardiovascular disease, either high lipids, high inflammation, or prediabetes, or overt diabetes. And a lot of these patients had no idea that was happening.
Right.
So, in fact, some of them weren't even aware that they had high blood pressure until they walked into my office and we did their vitals. And I'm like, oh, we've got a potential hypertensive emergency here. And they're like, no, I feel fine. I have, it's the silent killer.
Right.
And this, happened back in even my Equinox days. Whenever we would do an initial kind of intake for a training client, we take their blood pressure, and then we would see high blood pressure. It would be pretty crazy. So,
So aside from taking more enjoyment out of romantic comedies, what are some of the effects that a male would experience by going on testosterone deprivation?
Listen, so many things. Your brain's not going to work.
Now, why not? So when someone thinks testosterone, they think road rage, or an 18-year-old guy kind of like hitting the clubs, or 21-year-old, I guess. And so you don't think brain function. What is the link there?
There's a lot of receptors in the brain for testosterone. Now, a gross majority of my men, whenever they go on testosterone, they will tell me, man, it's like a light switch.
Like a light switch.
My motivation is so much higher. I feel so much better. I feel so much more motivated. I'm not a crabby old man. That's
debatable.
And some patients who had to come off of their testosterone for reproductive reasons.
Right. They get excuse me. I almost slept. They get kind of crabby.
Oh, no, they will definitely. They will feel it. It's like it's a sudden drop because, of course, if you go on TRT, you're not making your own testosterone anymore.
Right.
So they will feel a sudden drop and they're like, wow, I feel old. Now, your ability to regenerate as well and heal, that is something that is mediated by testosterone as well. So they're going to feel like joint pain. They're not going to recover from their workouts as well. In fact, I had one patient whose orthopedic surgeon put a testosterone pellet in him so that he would heal from his surgery a lot faster. He had like a freak accident on his bike and broke his femur.
Right.
And he was given a pellet, so, to facilitate the healing process. So,
I mean, obviously that would work downstream. So if you can't really train as hard as you could and be as active, chances are your overall level of activity would go down.
Yep.
Your ability to process nutrients. I imagine where calories go when they're consumed would not be as high. So chances of more diabetes or heart disease would be kind of in the male for that person.
Insulin resistance, yeah. So if they're not able to actually build muscle as well anymore, then they're going to start to develop insulin resistance. So the more muscle mass you have, the more sensitive your insulin receptors are.
What about cancer risk with being bottomed out on testosterone? Is there a link there?
Yeah, in fact,
they
they recently found that patients who had, and this was like a really, I think this was some sort of oncology journal. I don't recall exactly which one, but it was a reputable one. If the patient had low free testosterone, their chances of actually developing an aggressive prostate cancer is higher. So that goes counter to what everyone was concerned about in regards to prostate cancer or, enlarging the prostate. But yes, that's what they have found.
Now, so you touched on something, and I want to end there, and we can kind of leave this on a cliffhanger because there's a lot to talk about hormones and COVID, and hormones in general is always so fascinating. What is the difference between free testosterone and total testosterone? Because people sometimes they think they're interchangeable, but they're not.
Not at all. Total testosterone is the total output of your boys.
Right. So got it.
Or if you were on replacement therapy, then it's going to be the total amount that's actually injected into you.
Being injected into you. Yeah.
Now, most of that testosterone is actually bound up by something called sex hormone binding globulin. That's
sex hormone binding globulin.
Yeah, it's kind of I like to call it. It's kind of like the needy partner. Kind of like clings onto the testosterone. Doesn't let it do anything. So you can't go work out. You can't go shopping. You can't go have fun. So whenever it's bound up by sex hormone binding globulin, the testosterone, it is inactive.
Got it.
So again, that can be a positive, but in the case of most males, that is not a positive. So the free testosterone is whatever that's left around to actually go and exert its
So the
effects.
active,
it's active. Yeah. So it depends. Now, if a person, I have found maybe 2 cases, and these patients were not under my care for testosterone, by the way. They were under the care of another doctor, but they were on TRT. But their sex hormone binding globulin was also super high. So their total was around 1,400, but their free was actually at like 10 or something.
So they're making a lot of testosterone, or at least they have a lot of testosterone coming in, but
Yes.
they can't use any of it.
Nope. It's completely bound up. And
Okay.
there are reasons for it. Multiple reasons. If the person's not eating enough, if their omega-3 status sucks, if they don't have enough vitamin D, if they're excessively stressed. There's many things that will actually contribute to
It's like
sex.
whack-a-mole, yeah.
Yeah, or if there's some sort of liver issue problem. So that's something that we try to avoid as much as possible by ensuring that patients are eating their protein, exercising, sleeping, and having all their nutrients on board, even before I start to have the conversation of testosterone replacement. So that is something to look at. So I've just recently had a patient who said, yeah, my testosterone was, he's on TRT. He said, yeah, my doctors measured it at 600. And I'm like, what's the free? And he said, "Oh, I don't know. They didn't measure it." And this guy doesn't feel good. Mm-hmm. He's like anxious. He's depressed. And I was like, I can't tell you why that's so, because I don't know what your free testosterone looks like.
Free is. Now, is estrogen protective against COVID-19?
Estrogen is there to regulate your immune system.
Okay.
So you need a little bit of it. But men do not need excessive amounts of it.
What about for females?
At women, interestingly enough, if once they start to go head towards perimenopause and menopause, the chances of them developing an autoimmune disease actually goes up.
Okay.
So a lot of autoimmune diseases actually start to rear its ugly head in like a woman's 40s. So that's when her estrogen starts to decline. But again, it's a balance here. You don't want too much, but you don't want too little. And in the case of men, you do not want too much. You don't want it. You start getting man boobs. If for a long period of time,
Yeah, don't say that around me. I'm always sensitive about that.
Yeah.
So not too much, not too little, perfect balance. That's the same principle with Coffee with Alice. That's where we're going to leave you this time. And like I said, we try to give you the cutting edge information. So if something hits the news cycle, we'll be sure to talk about it. Dr. Alice, thank you. See you next time.